Hi there, I'm Katie. I'm one of the clinical leads on Cherry Ward. So I've been working on Cherry Ward for about a year and a half now. A year of that I've been a clinical lead. Cherry Ward is a ward where we look after all elderly patients who are suffering with a mental illness. They're here for an assessment and for treatment, and we're part of their recovery, being admitted into hospital. The team is made up of nurses, ward managers, clinical leads, doctors, healthcare assistants, physios and occupational therapists, and we all work really well together to ensure that our patients are discharged in a safe and timely manner. Something that I'm extremely passionate about is staff wellbeing, and being in the Band 6 role means that I can support the staff that I work with when they need additional support, when they need supervision. We do face challenges on the ward and difficult events, and I think it's really important that we check on our staff and make sure that we're all okay. So supervision and managing the staff is something that I thoroughly enjoy as part of the Band 6 role on Cherry Ward. I think that during the pandemic we've had some particularly difficult times. Some of the staff haven't been able to see the families, some of the staff themselves have had COVID, and the loved ones have had COVID, and it has been an immensely challenging time for everybody. I think in mental health we're seeing the aftermath of the pandemic and the mental illnesses that are as a result of the pandemic, and I think times are challenging at present, and it's really important to check in with those staff, make sure they're resilient and able to deal with those problems. Another thing that I think is fantastic with being in the Band 6 role is that I've been given many training opportunities. So I've been able to complete training on emotional unstable personality disorder, my first aid training, suicide training. I've been given the opportunity to have coaching with someone more senior than myself, all of which is I'm developing. I can feel myself developing into the nurse that I want to be, and a nurse that I think is a role model to others. I enjoy working with the Band 5 nurses, particularly the preceptee nurses and the students who I can work with, and we can develop their skills and we can find out what they're good at, what areas they need to work on, and I found that really rewarding. Part of the Band 6 role is doing the audits. The audits, I guess, is something that we can showcase what we're doing well. I believe that we do things well and that we should showcase what we're doing well. Audits also show what we're not doing so good, and I guess that means that we can work on it with myself, the other clinical lead and the ward manager. And it is, I guess, that highlights the importance of why it's so important to work so well in a team, so you can get those jobs done and ensure that the patients are getting a high level of care. NHS and the MHSOP service is ever changing, and I've found that since being in this role that the management are keen on change and that the service is evolving, and as a Band 6 I'm able to be part of that change, and if I've got any ideas I can be listened to, and we can further explore what to do to ensure that the patients are getting a high level of care. You can be the voice for others on the ward that don't necessarily feel able to speak up, and to work with them. If they have an idea, work with them to elaborate that idea and actually put it into practice. We plan for CQC visits, and as part of the Band 6 role we work with the Band 5s and the healthcare assistants to ensure that they're feeling confident about upcoming visits, and again to showcase what we are good at, because we are good at a lot of things, and it's important that the staff remember that. I do love working in MHSOP services, and especially on Cherry Ward. I find that the team is a fantastic team, and you're thoroughly supported by management. Yeah, and I would recommend the job for anyone that wants it. Thank you.